Welcome to the deep dive. You send us your sources, we dig in, and basically give you the knowledge you need fast.
Yeah, making sense of things efficiently.
Exactly. So today, we're looking at an article, it's written in Nepali actually, and it's all about evidence-based physiotherapy practice, EBP for short.
hmm And our guide here is the author, Binaya Kandel. He's got quite the background.
He really does. Senior-most physiotherapist for the Nepal government?
Co-chief physiotherapist at the Ministry of Health and Population, chief of the physio unit at Bir Hospital.
Plus past roles with the Nepal Physiotherapy Association. So definitely someone with deep expertise.
No question, he knows his stuff.
So our mission, if you will, for this deep dive is pretty clear. Get a handle on what Binaya Kandel means by evidence-based physiotherapy.
Understand why it can be tricky to actually do it in practice.
Right, the challenges. And then explore some solutions he suggests, which, might apply way beyond just Nepal.
And Binaya Kandel starts the article with something probably quite familiar to many people.
Oh, yeah. What's that?
Well, think about someone needing physiotherapy advice. They often get suggestions, right? Maybe well-meaning.
But not always based on solid proof.
Exactly. Like maybe a gadget a relative sent over or those magnetic pads you see advertised.
Ah, yeah. Things marketed with big claims, but maybe not much science behind them. Or just treatments that seem new and exciting but aren't proven.
Precisely. And Vinaya Kandel, he raises a concern here about the cost, the financial side for patients.
And the potential health risks, too, if the treatment isn't right or effective.
Absolutely. Plus the ethical side for the professionals involved. It really begs the question, what should guide physiotherapy?
Which leads us straight into EBP, evidence-based physiotherapy. So according to Binaya Kandel, what is it fundamentally?
He describes it as a modern and really essential approach. It's about blending timely new methods with facts based on research, but also, and this is key, considering the patient's own expectations and beliefs in how you treat them.
Interesting. So not just the science. Binaya Kandel breaks it down into three core pillars, right?
He does. Pillar 1, the best research-based facts.
Okay. What does that really mean in practice?
It means making treatment choices based on the strongest scientific evidence available, not just, habit or what someone thinks works.
Right. Less anecdote, more data.
Exactly.
Yeah.
And Binaya Kandel mentions different types of research here, like descriptive studies. They tell us how common things like back pain are. Then you've got interventional studies, clinical trials, basically, testing if a specific treatment, say lumbar traction, actually helps.
And he points to a gold standard type of research.
Yes. The highest quality evidence generally comes from systematic reviews and meta-analyses.
Okay. Explain those a bit.
Well, they essentially gather up and synthesize the results from multiple studies on the same question, so you get a much bigger, more reliable picture.
Got it. More power in numbers.
Kind of, yeah. And based on all this, you get clinical practice guidelines. Binaya Kandel sees these as, like, the best medical literature to guide practice.
Okay, so pillar 1 is solid research. But the second pillar is the physician's experience and expertise. Why is that still needed if we have the research?
That's a really important point Binaya Kandel makes. Research isn't always perfect, right? It doesn't cover every single scenario.
Or sometimes studies might even conflict.
Exactly. So that's where the clinician's skill, their expertise, comes in. It's about interpreting that research thoughtfully and figuring out how to best apply it to the individual sitting in front of them, adapting things based on professional judgment.
So it's not just like following a recipe.
Not at all. And Binaya Kandel specifically brings up the local context, social factors, economic realities, cultural background.
Ah, so research from, say, a wealthy Western country might not apply directly in rural Nepal without some thought.
Precisely. You have to consider if it makes sense locally. That's part of the expertise.
Makes sense. Okay, pillar 3, patient expectations and beliefs. How does this fit into an evidence-based model?
This is crucial. It means really listening to the patient and respecting their values and preferences when deciding on treatment.
Can you give an example from the article?
Yeah, Binaya Kandel mentions, for instance, someone in a remote area might need to stick with familiar home treatments like heat or cold packs.
Just because they're accessible.
Right, even if you're introducing newer methods alongside. Or maybe a patient really believes a certain treatment helps them, even if the research is still emerging. Their belief matters and needs to be part of the conversation.
Okay, so EBP is really this three-legged stool. Research, clinical skill, and patient values. You need all three for balance.
That's a good way to put it.
Now, Binaya Kandel also spends time on the problems, the downsides, when EBP isn't the standard. What are the big issues he flags?
Well, a major one he highlights is the financial cost to patients.
Absolutely.
If people are paying for treatments that aren't actually proven to work, or maybe aren't even necessary for them, based on, say, shaky claims or just anecdotes.
The money is essentially wasted, and healthcare can be expensive.
Exactly. It puts a real financial strain on people. That's a key problem Binaya Kandel points out.
And it's not just about money, is it?
No, definitely not. He also stresses the potential for actual harm. Using unproven or inappropriate interventions could worsen a condition or cause other problems.
That's serious. So choosing treatments that lack evidence isn't just ineffective, it could be actively harmful.
It could be, yes. That's a significant concern Binaya Kandel raises.
And this must have implications for the physiotherapy profession itself.
Absolutely. Binaya Kandel talks about how not sticking to EBP can erode the ethical foundation of the profession.
How does that work?
Well, if practitioners are making misleading claims or promoting treatments without good evidence, it damages the public's trust.
Right. Trustworthiness is crucial in healthcare.
Totally. It undermines the credibility of physiotherapists and the profession as a whole.
And Binaya Kandel suggests it's not just up to individual physios.
No, he points out that professional bodies, like physiotherapy associations, and even well-informed patients, actually have a role to play in pushing for EBP.
So it's a collective responsibility, in a way.
It seems so, yes. Everyone benefits when care is based on good evidence.
Okay, so we see the problems of not using EBP, but why doesn't it always happen? Binaya Kandel discusses barriers, drawing from the situation in Nepal, but these sound like they could be global issues.
They likely are. One major barrier he cites, based on a Nepali study, is simply a lack of proper orientation or training for physiotherapists, specifically on EBP.
Ah, so they might not fully know how to find, evaluate, and apply the evidence.
Potentially, yes. If you're not trained in the how-to, it's hard to implement it. That's a significant hurdle Binaya Kandel identifies.
What else gets in the way?
Time. Or rather, the lack of it.
The classic issue in healthcare.
Yep. Physiotherapy sessions are often quite short, and really doing EBP well, keeping up with research, assessing the patient thoroughly, discussing options that takes time.
More time than might be available in a standard appointment slot.
It can be, yeah. That's another barrier Binaya Kandel highlights.
Right. The third key barrier is often a lack of necessary resources. This could be anything from easy access to research databases and journals.
To having the right tools to measure if the treatment is actually working.
Exactly. Outcome measurement tools. Without those resources, it makes implementing and evaluating EBP much tougher.
Okay. Lack of training, lack of time, lack of resources. Sounds familiar. But Binaya Kandel doesn't just list problems, he offers solutions, right? Strategies to implement EBP better.
He does. A core suggestion is that physiotherapists need to be, well, proactive, actively seeking out and reading relevant research when clinical questions pop up.
So continuous learning is key.
Essential, according to Binaya Kandel. You can't just rely on what you learned years ago. But again, the time issue. How do you manage that if you're constantly needing to look up research?
That's where he brings up clinical practice guidelines again.
Ah, the summaries based on the best evidence.
Exactly. Well-made guidelines can be a shortcut, helping clinicians access relevant findings quickly. But, and Binaya Kandel stresses this.
It's not about blindly following them.
Right. You still need to use your clinical judgment. Consider the individual patient, their beliefs, your experience, all those factors.
It comes back to that three-legged stool.
It does. He calls this integration clinical decision-making. It's the synthesis of everything.
Got it. What else does Binaya Kandel recommend for implementation?
Using measurement tools consistently. Outcome measures.
Why are these so vital for EBP?
Because they let you track progress objectively. You need to know if what you're doing is actually helping the patient. Binaya Kandel mentions the Nepali numerical pain rating scale as an example.
A way to quantify pain levels.
Yeah. And he notes there are efforts to translate and validate more of these tools in Nepali. Using them helps physios see what works and adjust treatment if needed. It makes practice accountable.
Makes total sense. Anything else on the strategy front?
Ongoing professional development. Workshops, seminars, interacting with colleagues. Binaya Kandel emphasizes this need to keep learning and updating skills related to EBP.
So learning doesn't stop after you qualify.
Definitely not. And interestingly, he also brings the patient back into the picture.
How so?
Binaya Kandel suggests that patients, the service users, should feel empowered to ask questions.
Like what?
Like, what's the evidence for this treatment? Or are we tracking my progress with any specific measures?
Uh, so encouraging patients to be active participants in ensuring their care is evidence-based.
Exactly. It promotes transparency and partnership.
And finally, any role for the wider system.
Yes. Binaya Kandel mentions regulatory bodies like the Nepal Health Professional Council. They have a key role in setting standards and promoting EBP across the whole profession.
So kind of ensuring a baseline level of quality care based on evidence.
That seems to be the idea, yeah.
Okay, so let's wrap this up. This deep dive into Binaya Kandel's article really underscores that EBP isn't just one thing.
No, it's this dynamic process, isn't it? Balancing the best research evidence.
With the physio's own expertise and judgment.
And, crucially, with what matters to the individual patient, their values, their situation, their beliefs.
And Binaya Kandel makes a compelling case that moving towards EBP means moving away from relying purely on tradition, anecdote, or unverified marketing claims.
Yeah, it's a call for a more rigorous, more thoughtful, and ultimately more patient-focused approach to physiotherapy.
Definitely. So here's a final thought for you to chew on. We talked about evidence-based practice, but now think about the sheer amount of health information swirling around online. Some good, some not so good, often lacking real evidence.
Yeah, Dr. Google and all that.
Right. So how might this easy access to online info, both for practitioners trying to keep up and for individuals looking for answers, how might that complicate things further? Or could it maybe even support the move towards truly evidence-based care globally?
That's a tricky one. Does more information help or hinder when quality is so variable?
Something to think about. Thanks for joining us on the Deep Dive.